welcoming Dr. Shiriki Kumanyika.
Thank you for being here, and thank you for being public health. What a privilege and honor to be standing before you in this role. It's especially exciting for me because I took office as president just at the time that APHA announced its commitment to make America the healthiest nation in a generation, to start a public health movement. I think of a public health movement as going beyond public health practice as a profession. To me, a movement incorporates and leverages the passion that brought us to public health and which keeps us going in the face of the tremendous challenges that we face. I also think of the public health movement as involving us not only as professionals, but as people, as citizens. And as one of the senior citizens of the profession, I think of public health, the movement, as one that will inspire and tap the energies of the newest members of the profession. Those of you early in your careers who see the potential of public health to change your lives and to help you change the lives of other people. My travels as APHA president have taken me to Kolkata, India, to the World Congress on Public Health, to the annual meetings of state public health associations in the East and the Southeast and the Midwest. These experiences have greatly expanded my understanding of the scope, the depth, and the diversity of the issues we're dealing with, and shown me that we are connected by a common vision that transcends our individual specialties and our favorite issues. Meeting so many people with so many different perspectives reinforced my sense that if we can't all see a big picture, if we can't see ourselves as one family combining our energies under the big tent, if we don't see the end game that we're trying to win with this team sport that we call public health, then our collective efforts might not add up in the end to better health for populations. As APHA president, I also had a chance to put some of my ideas on the permanent record. I wrote columns in the nation's health throughout the year. I wrote about healthy weight issues, the need to engage with the private sector, about racism, poverty, immigration, the food system, environmental sustainability, the need for relevant science, about the need to think forward and stay ahead of the curve. And I wrote and often spoke about our central challenge and commitment to work together to make America the healthiest nation in a generation. By now, many of you, if not most of you, have heard the statistic that we in America spend more on health care than any of our peer countries, than other high-income nations. According to the analysis by Bradley and Taylor in their book on the American healthcare paradox, the picture becomes clearer when you take a broader look and you include spending not just on health care, but also on social care. And that's what's shown on this slide. The top of the bar is the spending on social care, and the bottom of the bar is the spending on health care. Social care refers to social services such as retirement and disability benefits, employment programs, and supportive housing. So it's the total spending on health care and social care combined that is really associated with better health outcomes. So when you look at it this way, and you can see where the arrow is pointing, we've put the two types of spending together here, and we're not spending the most. We're not at the top. We're in the middle. And the striking thing that you will see if you look at the size of that top part of the bar is that America is the only high-income country that's spending more on health care than on social care. The desirable ratio is just the opposite. Something like a 2-to-1 ratio, spending twice as much on social care as on health care, is really what we need to get us where we're going. So we're a long way from getting there. And so as one would expect, our health is not as good as that in those other countries. We rank lower compared with our peers on a variety of measures: chronic diseases, accidents, violence. We also have higher disparities. So another statistic that you've heard often from us is that there can be as much as a 15-year differential in life expectancy based on your zip code, based on where you live. But the disparities don't account for the difference in our health versus other countries. Even our well-off Americans who don't smoke, who are not struggling with their weight, appear to be in worse health than their peers elsewhere. This is why we set the goal of creating the healthiest nation in one generation. If we take the health status in other countries as an indication of what is possible, that means that it must be possible here. Healthcare access is important, but it's not enough. We need to have an impact in many other spheres, the spheres that are shown on this slide. Education, income are critical. Conditions in neighborhoods, housing conditions, the environment, the climate, as you've heard, the food system, the opportunities that people have to make choices that promote health and that keep them healthy throughout their lives. So most of what it takes to have a healthy population has to happen outside of the doctor's office. To create the healthiest nation, we need to make health a part of the decision-making process in areas of our society where we haven't always been at the table. We in public health do not control the resources and the agenda of all the spheres and sectors that influence health. And what that means is that there's an opportunity and a mandate to align our mission and goals with those of the sectors that do control those resources. Addressing health equity is a major part of the Healthiest Nation effort. Inequities in the conditions that influence health have a greater impact on the populations that are in need of our special protections, the protections of public health and of human rights. This includes populations of color, as I've mentioned here, but inequities affect many other subgroups in our population, and you know who those groups are. So you might have heard the expression, "We are the ones we have been waiting for." I've heard that first in the Civil Rights Movement, in what used to be the National Black Women's Health Project. You've heard it from other presidents speaking to you in the opening session of an APHA annual meeting. I think that we can apply this to an issue. Let's think health equity is the issue that we have been waiting for. And what I'm talking about is calling it health equity. It emphasizes that we need to go beyond disparities and beyond diseases and beyond comparisons with the best that we have in American population, because we know that's not the best that we can do with human life. And we need to strive for all people to achieve their health potential. Health equity points us to social determinants in a really positive way, in an inclusive way. We're talking about everyone while giving special attention to people who have farther to go. As I traveled around the country, I felt that it was transformative. I saw people standing up with an expectant look. How can I help with health equity? I don't think disparities language was getting us there. So this is going to be an important and very positive part of the conversation as people try to learn how to understand it, explain it, and implement it in their workplaces. So how do we get here? Getting to the healthiest nation requires working on a broader scale than we've ever done before, generating broader support for the issues that matter most. It requires us to be or become Generation Public Health. See yourself in this picture. We are not just public health professionals or professionals to be. We are a growing movement of people, communities, and organizations. We are reframing the conversation to expand beyond health care to focus on determinants of health. We are reaching outside of the typical public health sphere to form new partnerships in all the areas that affect people's health. Here's the agenda. I think here's the agenda. Our elevator speech has to include the elements that are shown on this slide. This is not a new agenda for us. What's new is that we're promoting this agenda as a movement. It's a movement not talking to each other, not in the echo chamber, but among everybody who can have an influence on health. What's new is that we've given our movement a name that's easy to say, easy to remember. What's new is that we as a public health team are spreading the message, and the message is, for all the money we're investing, we are not getting our money's worth in terms of population health. And we can do better, and we will do better. Generation Public Health is the name of our movement. Being a part of this generation is not limited by age. Everyone here is invited and urged to join. In fact, I hope that being in this room and at this meeting means that you're already involved or will quickly become involved. This call to action is not to move out of your comfort zone. This call to action is to make this your new comfort zone, to be comfortable with reaching out as Generation Public Health. Please be the generation that educates those around us about the challenges we face on the broader issues, ask people to join Generation Public Health, sign the Healthiest Nation Pledge, become an advocate locally and nationally. APHA gives you messages to send to your members of Congress. Even if you think your Congress member has already decided and it's hopeless, send it anyway. Members of Congress need to hear from us about the challenges in public health. Approach your employer, other professional associations, ask them to become partners. Find us new partners and make it easy for them to see themselves in this picture. Use the power of social media. Get our message heard louder and louder and louder until we drown out the messages that are holding us back. And you know what I mean. The more supporters we collect, the more influence we can have. So we have 60,000 now. That's a small cohort study. We need millions. We have to have as many as possible speaking the language, telling the story, spreading the message. So in conclusion, thank you again for being Generation Public Health. Whether you are a millennial, a baby boomer, let's all be in the same generation to create the healthiest nation and change the course of populations in America. Thank you. And now I'm delighted to introduce my friend and colleague, Dr. John Lumpkin. Dr. Lumpkin is the Senior Vice President and Director of Targeted Teams at the Robert Wood Johnson Foundation. Before joining the foundation, he served as the Director of the Illinois Department of Public Health for 12 years, so he is an Illinoisan, a Chicagoan. He's with us today to discuss the Robert Wood Johnson Foundation's Culture of Health initiative. So please join me in welcoming Dr. John Lumpkin to the stage.